Good afternoon and welcome to Reproaction's Act and Learn webinar for the month of February 2021. Today's topic is an extremely important one, strengthening paid family leave. First, we'll introduce your host. The first voice you're hearing is myself. I'm Erin Matson. I use she, her pronouns, and I am Executive Director and co-founder of Reproaction. I'm based in Arlington, Virginia, and please follow me on Twitter at Erin2themax.
And my name is Shireen Shakori. I am Deputy Director of Reproaction based in Washington, D.C. And you can find me on Twitter as well at Sheermean.
Great, and I want to acknowledge that Shireen pulled this webinar together and visioned it and recruited our speakers and pulled together this. So thank you to Shireen. All right, so for our agenda for today, we will introduce Reproaction, talk about who's getting left behind in the current paid family leave policies or frankly lack thereof. And then we'll have a panel discussion featuring experts from a variety of hats. We'll be joined by Elizabeth O'Donnell, Vasu, Reddy, and Stephanie Fewsmith. We'll move on to next steps and then we'll have a Q&A at the end. So a note about that, if you have questions for any of our panelists or speakers, feel free to put them in the Q&A tab at any time during our presentation. We'll get to as many as possible at the end. And also, for those of you who like to live tweet, we encourage that. You can use hashtag Reproaction. So Reproaction is an organization leading bold direct action to increase access to abortion and advance reproductive justice. We're proud of our left flank analysis. We're known for our willingness to hold folks on all sides of the issue accountable, whether they're traditionally considered allies or opposition. And we have a deep commitment to nonviolent direct action as one of the tools in our toolbox. So we'll be hearing from Elizabeth Skoski on our team shortly, but I wanted to tee us up with a few things about paid leave. First off, inequity in paid leave is discrimination, period. It's a sad state of affairs that the United States does not guarantee paid parental leave to all, and many workers are not even guaranteed unpaid parental leave. Access to paid parental leave is a reproductive justice issue. Birthing parents need time to physically recover from childbirth, bond with and care for their babies, and learn how to rebalance their lives with their new obligations. And I want to highlight that in particular, due to structural discrimination impacting all areas of their lives, Black women tend to be the most adversely impacted by lack of access to paid parental leave. This has deep impacts on maternal health. Studies on paid family leave in the United States and other countries show that long and short-term benefits for paid leave for mothers and children, including fewer low birth weight and preterm births, increased breastfeeding, reduced rate of hospitalization for infants, and improved maternal health outcomes. And another piece of where this impacts is the racial wealth gap in particular, and thinking about it with regards to access or lack of access to paid family leave. A typical white family has $140,500 in wealth, whereas the typical Latinx family has $6,300 in wealth, and the typical Black family has $3,400 in wealth. These gaps have a direct tie to the impact of not having access to paid family leave and therefore continuing economic as well as physical health impacts. Finally, I want to highlight the Family and Medical Leave Act, which was passed in 1993. So we're coming up on multiple decades without updates. It provides up to 12 weeks of unpaid leave for eligible employees to care for seriously ill family members or for the arrival of a child. It applies to public agencies and employers with 50 or more employees, and because of that, it covers only 60% of the workforce because many people work for employers with smaller than that number of employees. Furthermore, I want to highlight again that that's just unpaid leave, which is untenable for many people. And with that, I'm very pleased to pass this to our Development and Operations Manager, Elizabeth Skoski from Reproaction. Liz, thanks for joining us today.
Hi, thanks for bringing me on. So I just wanted to talk a little bit about my experience with the Family Medical Leave Act and paid family leave, and a bit of a hidden problem that I discovered when I was pregnant and I was trying to switch jobs. So as Erin covered, there's a lot of restrictions that apply to the Family Medical Leave Act that are really left out of the conversation when we talk about FMLA and family leave. And a major one is actually a time-based restriction where, based on how long you've been working for an employer, it outlines that you have had to have worked for that employer for 12 months, totaling 1,250 hours. So very obviously, this leaves out a large segment of our population, which includes part-time workers or workers who might have gaps in their resumes for a variety of reasons. And something that I realized is that it also adds a major hurdle to people who can become pregnant and their career tracks. Kind of at some point, these two timelines begin to butt up against each other when you might be looking to change careers or change jobs or just seeing where you want to move on with your professional life, and the idea that when you wanted to start a family, those two timelines really begin to overlap, and this time-based requirement makes it really difficult to continuously access the leave. So I knew if I became pregnant that if I switched jobs, I would lose access to any leave whatsoever. And it kind of sounds like an individual problem. I didn't think that it was so widespread until I started to research it, and finding out that the way that we do working nowadays is just very, very different from previous generations. So I came across facts and figures like millennials on average are changing jobs 4 times within the decade after they graduate from college. So that's 4 times between the ages of 20 and 30 where they're losing access to this benefit if they become pregnant. And beyond that, about 60% of millennials, when polled, said they're open to new positions. So people are just simply not staying in the same position for any number of reasons. But this policy that we have isn't reflecting that reality of our professional world. So if you combine this with the fact that the age for people giving birth the first time is rising, it's rising up to about 26 years old on average nowadays. And with the unpredictability of how long it might actually take for someone to become pregnant, should they face any additional fertility issues, it's pretty obvious that making people wait a year at a job to start this leave or have access to this benefit is just untenable for the world that we currently live in. So what it's really doing is it's altering people's career paths, and it's also penalizing people who might not have strong job protections or people who might have to switch jobs for personal or other reasons. And I always like to talk about what we're going to have to see to change this in our society. So we saw a lot with the 2020 election, people bringing forth various paid leave policies or proposals. Senator Gillibrand's Family Act actually eliminates this time-based requirement, but it's going to take a societal shift in the way we think about leave right now. It's often considered a perk at best and a vacation at worst. So we're really going to need people in high profile positions to give and then subsequently take their own leave. And I always reference a Washington Post article from 2015 when Mark Zuckerberg was just lauded in the newspaper for taking 2 months off when his own company offered 4. So now we're starting to see that change. In 2019, we saw Alexis Onaham, husband of Serena Williams and founder of Reddit. He took his full 16 weeks of paid leave that his company offered that he made. So we're going to have to move the marker. We're going to have people actually giving and taking this leave so that it becomes an important part of these conversations.
Thank you so much, Liz. So with that, we're going to move into our panel discussion. And I'm pleased to introduce Elizabeth O'Donnell. Elizabeth is a dedicated educator with 7 years of experience in the DC public school system, currently teaching first grade math and science. After experiencing a stillbirth at 31 weeks and learning her employer was revoking her eligibility for paid maternal leave, she is committed to speaking out as an advocate for parents dealing with pregnancy loss and navigating paid leave policies. Elizabeth earned her master's in education and BA at the George Washington University. And if, like myself, you live in the Washington, DC metropolitan area, Elizabeth has, and her story has been in the news much recently, And so we really want to thank you, Elizabeth, for joining us today. Thank you.
Thank you so much for having me. I'm happy to be here.
Thank you. Well, so first question, we're just so grateful that you're able to join us on the call today to tell us your story of pregnancy loss and the subsequent horrifically callous treatment by your employer. Please share with our listeners your story to whatever extent you are comfortable and why you've chosen to speak publicly about it.
So basically, November 28th, I found out that my daughter no longer had a heartbeat. And so we started the induction process, and then I had her on December 1st. One of my big concerns, despite everything that was happening, was needing to contact work. I'm a teacher, these kids rely on me to be there, and so I was just worried about contacting work, what would happen with my leave now that it's changing. I originally had been granted leave from January 24th through the end of the school year. And so I had spoken to my principal about needing to revise that, and I had said I will only need the 8 weeks for postpartum recovery. And so when I had reached out to the leave of absence office saying that, my principal had he's been such a great help. He kind of let them know that something had happened and I would be reaching out. I would not be returning to work anytime soon. And so when I finally did reach out to leave of absence, the response that I got was, oh, well, you're not eligible for paid family leave anymore. You can take unpaid FMLA or just use your sick leave. And so at first, I kind of thought that maybe this gentleman just did not understand the situation because I did, in fact, have a child. And so we kind of went back and forth, and it was still, no, sorry, you're only caring for yourself, the end. FMLA is your only option. And so then that's when I decided to get a lawyer. And after my lawyer got involved, and I also just wanted to make sure that I wasn't misreading anything. It had seemed like I was reading everything fine, but my brain was very foggy. So when I got the lawyer involved, he said, no, you are reading the law as it is written. A qualifying event for paid family leave is birth of a child, and that is all it says. It does not say anything more than that for that qualifying event for birth of a child. And so when DCPS still rejected the claims for paid family leave, that's when I made a decision to go public with it. And that was a really, really hard decision. A lot of my family, they were not pleased that I did that. But I felt like I had to because I couldn't understand how if I birthed a child, now all of a sudden you're telling me that I'm losing my leave because I didn't walk out of the hospital with my daughter. And that felt very isolating. And so since going public, I have learned how many women have dealt with something similar. And this is not something I would have thought about in a million years. And now it's all I can think about. How many other women have had to go through this? And so that's why, it's kind of turning my pain into purpose. And I'm committed to learning about these paid family leave laws, talking about them, and hopefully changing them.
Thank you so much for sharing your story and for here with our listeners, and also for turning that into action. I'm certain that's not easy. So I wanted to ask, you mentioned finding that a number of other women have had similar situations, and I understand that you were able to find comfort in support groups online, and through the process of that, learn that other women have faced similar obstacles to securing leave time after losing a pregnancy. What have you learned from others who have dealt with similar situations?
So I have learned a lot. I had posted on one of the support groups that I had joined, just kind of asking, hey, has anyone else experienced this? Do you have any advice? And also, let me say, I understand that living in Washington, D.C. and working for D.C. government, it is I am grateful that paid family leave is even an option, because it is not everywhere. And I guess I kind of, when I originally found out I was pregnant and going through the process, I really had just taken it for granted. It was not something I had ever thought about before. And so, oh yeah, maternity leave. I'm sure everyone has that. And everyone does not have that. And so looking back on it now, I'm just like, oh my gosh, I just didn't know about this. So most women ended up just going right back to work, which, I mean, physically, I don't understand how they were able to do that, but they did. Some of them only took a week, and then went back and then ended up having severe mental health issues from doing that. And so these are things that should just not be happening. When you birth a child, that is a huge event for your body, and your body needs to heal from that. When you lose that child that you've just birthed, there's a whole emotional aspect. And, from the beginning, I haven't even spoken about the mental health aspect, because that is its own battle and something that our country is not always ready to talk about mental health. And so for me, just focusing strictly on the physical postpartum recovery here and not being granted leave for that, and all of these other women across our country not being granted leave for that, and then just going right back to work, to me is really just horrifying. And there are some states that do still extend paid leave for a stillbirth. There are some agencies within the District of Columbia that do. If you work for the private sector, they still give you your paid family leave for a stillbirth. DCPS has the choice to give that to me, and they are choosing not to. And so I also heard from some different women in the district that reached out to me saying, wait a minute, I was able to get it, why weren't you? So it's just too different everywhere, and that is a huge problem. Our bodies experience relatively the same thing when we give birth, some things more extreme than others, but the bottom line is we need to heal from that. We need to heal from that, and that needs to be recognized.
Thank you. And I'm just resonating so strongly with your choice of the word horrifying, and also thinking a lot about what you've raised, that other people and have gotten different results from the DC public school system. So it's clear that policies need to be made clear, and also shows that it's not just a policy failure, but there's people as well. And I just want to underline that types of decisions shouldn't be left to individuals who may not have common decency that you would hope that everyone would have, and this wouldn't be an issue. So I want to pivot a bit. Now that your story is out more broadly in the media, have you received support from your employer or colleagues since your story was published in the national media? And what would you like support for people who have shared your experience to look like?
So as far as from DCPS, they have not contacted me. I'm assuming most likely because I have a lawyer involved now, and we are still doing some legal stuff. My school that I work at has been nothing but amazing. And, I know sometimes people have, teachers have issues with their administrators and stuff. I have to say that for me, the support has been incredible. The DC Council has also been very helpful. They immediately reached out upon seeing my post, 3 of them, and I've been working very closely with Councilmember Silverman on her new bereavement bill that she has put forth. And while I absolutely support the bereavement leave changing from 3 days to 10 days, I think that is super important. I don't want to lose sight on the fact that my original argument here was receiving 8 weeks leave for postpartum recovery. And so this is a good start for DC to take with bereavement. I think especially with COVID this year, I hate saying, I feel like we have all lost someone, but for many people, that is a very real statement. With this past year, we've all lost someone or know someone who's passed away from COVID. So I think the bereavement bill is a great start. That will be brought up in March to include any child, stillbirth, spouse, sibling. The mayor would only like it to cover stillbirth and children under the age of 21 for 10-day bereavement. But I talked to Council Member Silverman about it, and she would like to extend that to more family members, which I think would be great. And so this is a start, right? And Councilwoman Silverman is still interested in talking about the paid leave things and how that will work and how to change the language. And so hopefully we can continue to work on that. And as far as support for people who have had this experience, I think from the jump, when I emailed leave of absence, there should have been some sort of understanding that this is a very sensitive and emotional topic, and that did not happen. The complete opposite happened. And so for me, being a teacher, I think about how I am expected to teach empathy and kindness to my students and teach them how to show that to others. And it's ironic that the District of Columbia Public Schools has not shown me that once. And so I think for people that have experienced this, you might never understand how they feel. And hopefully you won't understand how they feel. But you have to at least think, this person has just lost a baby. How would that make me feel? If this happened to my sister, if this happened to my best friend, if I knew maybe this had happened to my mother, what would I do to make sure that they felt a little less terrible? And how can I be careful with my words as to not offend? How can I give this person just a little bit of comfort? And that is just so, so important. And had my employer given that to me even in the least bit, I don't think we would be where we are right now. I think there would have been more room for conversation or understanding before getting a lawyer involved. So for supporting people who've experienced this, listen, let them talk about their baby, just be there. And my colleagues and my friends and family, they have been there. The council members, now that they're involved, have listened to what I have to say. And that has made me feel respected and a little less isolated with this, just awful experience.
Well, thank you, Elizabeth, for giving the Reproactions listeners a chance to listen to you today. And I encourage everyone to type in any questions you may have for Elizabeth in the Q&A, and we'll get to as many of them as we can at the end. Is there anything else you'd like to share now, Elizabeth, before I pass it back to Shireen for the next panelist?
No, thank you so much. Thank you.
Thank you.
Great. So I am going to introduce you all to Vasu Reddy, who is the Senior Policy Counsel for Workplace Programs at the National Partnership for Women and Families. She works closely with the Senior Policy Counsel to provide legal research, writing, and analysis on key workplace policy areas, including paid sick days, paid family and medical leave, pregnancy discrimination, and fair pay. While in law school, Reddy worked with a team of law students to design and conduct a study of barriers to education for Los Angeles public school students with disciplinary or juvenile justice issues, publish a report, and engage in advocacy based on her findings. She worked on reproductive rights issues as a legal intern at the National Women's Law Center and the National Asian Pacific American Women's Forum, and as an officer of Georgetown Law Students for Reproductive Justice. Prior to law school, Vasu worked at Sanctuary for Families, a New York City nonprofit dedicated to serving survivors of domestic violence and sex trafficking and their children. Reddy graduated with a Bachelor of Arts in Government from Harvard College. She holds a law degree with honors from Georgetown University Law Center, and she was a public interest law scholar. Thank you so much for joining us today and bringing all of your expertise in this topic. We are really excited to dive in.
Thank you so much, Shireen, for having me, and just extending also my thanks to Elizabeth for sharing your story and just having so much courage to navigate what I can't imagine how difficult a situation this has been. So just just thank you from the bottom of my heart for that. Yeah.
Yes, co-sign all of that. But on to our first question for you. So what does the legal landscape look like for paid family leave coverage of pregnancy losses?
So the legal landscape is unfortunately not very comprehensive in how it thinks about the or how it talks about the various experiences and caregiving needs and medical needs that people go through. So on the federal front, we have to start with the Family and Medical Leave Act, which covers, it requires that your boss provide you unpaid job protected leave. So you can't be fired, but you don't have to be paid for your own serious health condition, to care for a family member with a serious health condition, or because of the birth of a child. And in that language and in the regulations around the FMLA, it's not explicitly spelled out whether things like stillbirth or miscarriage are covered, but it's very clear from the just the plain language of the fact that birth and is covered, as Elizabeth pointed out. It only requires birth as the condition for qualifying for leave. But then also under the criteria for dealing with a serious health condition, any kind of the physical and mental recovery from miscarriage, from stillbirth, all would meet easily the criteria for what is a serious health condition. But because it's not named, it is really hard for people to even know that they have that right. It is easy for employers to just apply a really broad hand and deny leave, even though they are legally in the wrong. And it just leads to a lot of lack of clarity and confusion that means that there's not a right that you can count on. And that is a really, that is something that really needs to be addressed in the regulations and in the text of the law. But as some folks have mentioned, unpaid leave really doesn't work for a lot of people, not just because people aren't covered by the FMLA, but also because if you are already living paycheck to paycheck, you can hardly be expected to survive with your paycheck being taken away for 3 months. And so people are put in this untenable position of having to choose, do I deal with my health needs or my care needs and sacrifice my salary, or do I go make the money I need to support myself and my family, but really have to face detrimental effects to my health or my family's health. And so that's where paid family and medical leave comes in. And that is it is a model that 10 states in the US have, including DC, have adopted. And it's basically a social insurance program where you pay a small amount of payroll taxes into a fund, and that fund goes out to pay for to replace some of your salary while you are out on leave for your own serious health condition, the birth of a child, or a family member's serious health condition. So that provides some level of financial backstop for people who have these caregiving needs so that they can take the time that they need. So that's been enacted in 10 states, and it's in the 3 of those states have not taken effect yet, so 7 states have this in effect. There are very few actual bereavement laws, bereavement leave laws in the US. The only ones I could find were in Oregon. There is bereavement leave for the death of a family member, and in Illinois, there's bereavement leave for the death of a child. But both of these are unpaid. they're only about 2 weeks in most cases. And so all of the same shortcomings that you experience with the unpaid FMLA, you experience here. And then finally, there's the Pregnancy Discrimination Act, which at a federal level, and then several other state laws that are designed to require accommodations for people experiencing conditions related to pregnancy or childbirth. And so from those, if you were dealing with a miscarriage or with a stillbirth, you would be dealing with a condition related to pregnancy or childbirth and therefore able to request an accommodation. You may be able to, you could argue that leave is the accommodation you need or a flexible schedule, but your employer would have to give you some kind of accommodation and would not be able to deny you an accommodation that they would give to someone else. So for example, if they let someone else take leave for the death of a spouse, they would have to give you the same kind of leave for a miscarriage or stillbirth. And so that's kind of the patchwork of laws that are here. And I think you can tell from that piecemeal approach that it's really important to make sure that programs like paid leave are as broad and comprehensive as possible.
100%. Now, it's been described a bit earlier in the webinar, but I want to ask why, in your opinion, is paid leave essential to anyone who experiences pregnancy loss, or becomes a new parent?
Yeah, it's a great question, and others have spoken about it eloquently, but the fact is that unpaid leave does not work for most people. Under the FMLA, there are already limitations on whether you're covered that rule out people who are starting at a new employer, rule out people who work for small businesses, and most part-time employees. And again, you can't afford to go without that leave. And when you look particularly at people of color and workers of color, we know that people of color face health disparities and wealth disparities, both of which would be aggravated by not having access to paid leave. But also they are in the jobs that are least likely to have paid leave. So it becomes this vicious cycle. It's also really important that the leave covers all purposes for leave. So not just parental leave or birth of a child, but also dealing with your own health condition or caring for a family member with a health condition, because it's an equity issue and a racial justice issue, because people of color tend to have more caregiving responsibilities and provide more unpaid care, and also are more likely to live in multi-generational households where you might need to care for a parent or a grandparent. But it's just really important that if you have this broader set of purposes for leave, then you are less likely to have cases where it falls on it's a borderline case and which makes it easy for your employer to deny leave. But ultimately, and I'll get on my soapbox for just a second, the way that our economy is structured to devalue care and devalue workers and their families, that is based in white supremacy. That is a legacy of the fact that that it is a legacy of slavery, of wanting to exert more control over workers and to take away their ability to have rights in the workplace, and also based on the history of women of color and Black women in particular holding a lot of care jobs and domestic work jobs, and because of that, those job categories being left out of traditional labor protections. And so I just wanted to elevate that and make it explicit that one of the reasons that we don't have paid leave is white supremacy, and and we really need to remedy that.
100%. I am snapping along to the notion of the devaluation of care work in particular, and care work across generations. And the ongoing pandemic and how we're dealing with it is showing the cracks in that system and how certain populations have to deal with a lot more of the care work for their elders and their communities than others. So thank you for bringing all this up. And if anyone has more questions for Vasu, you can type them into the question box, and we'll try to get to all of them at the end. But for now, I will kick it to Erin to introduce our next speaker.
Thank you, Shireen, and thank you, Vasu. So now I'm pleased to introduce Stephanie Fewsmith, who uses she, her pronouns. She works as the development director at Boulder Valley Women's Health Center, an independent nonprofit abortion provider and reproductive health clinic in Boulder. Prior to joining them, she lived in Virginia and worked with NARAL, Pro-Choice Virginia, and the DC Abortion Fund. Stephanie is the longtime advocate for reproductive rights and has strong feelings about using gender-neutral language when it comes to pregnancy, birth, and abortion. Steph lives in Colorado with her husband, daughter, cat, 2 dogs, and some fish. Thank you so much for joining us, Steph, and congratulations on your new baby.
Thank you so much. I appreciate it. And I also want to say thank you to our other panelists, Elizabeth, for sharing your story, and Vasu for sharing all of your expertise.
Thank you. Well, let's dive in with some questions for you. So you both recently took paid family leave and rewrote your workplace's leave policies to be more equitable and inclusive. So first, I want to know, what did having your leave time mean to you?
Yeah, so my leave time was extremely important to me. Of course, it was, time to bond with my new baby and figure things out as a first-time parent, and as a family, especially having a baby during a pandemic when we really didn't have any physical help from our family or friends or support networks. But I would say even more importantly than that was the time for physical and emotional recovery from birth. I was lucky to have a relatively uneventful birth and pregnancy. So I truly can't imagine having a more traumatic experience, or even a C-section, a major surgery on top of this. I definitely experienced a lot of things that I wasn't particularly prepared for, extreme, hormonal changes and things like that had me crying every day. I have had anxiety for a long time, and it's definitely been compounded post-birth. So those things on top of the physical recovery were so important for me. I can't imagine having to work at the same time as navigating some of that. And, in fact, just being back to work about a month now, I still am navigating some of those things, though not as strongly as before. But it was, especially having some paid leave was extremely important to keep the anxiety down a little bit and make me feel a little bit more comfortable stepping into this new role as a mother.
Thank you for that. So let's talk a bit about what you did in your workplace. So what did your process look like for reassessing and improving your workplace's paid family leave policy? And just like bluntly, what was it before and what is it now? What considerations were made, and have you seen improvements in your workplace so far as a result of making these changes?
Yeah, so first of all, I don't want to overstate my role in rewriting the policies. I feel like I kind of came in as a squeaky wheel for the situation, and it was definitely a big team effort. I wasn't the one who made the final policies, but I was able to give a lot of input. And this is also kind of a two-part story, where it started at my previous workplace, where I was in 2019. Knowing that I wanted to probably take paid family leave at some point in the future. That company was covered by FMLA, but as far as I could tell, the leadership who was in in the position to make policies didn't really share my values on paid family leave. So I spent a lot of time doing research. I prepared a lot of points, especially for the benefits to the company, based on what competitors were offering, the cost of employee turnover, business benefits, things like that, that I thought would get through to them. Unfortunately, in the end, I did not have support from leadership at that company to make any changes to the policy. And I did state that as one of my reasons for leaving, in hopes that it helps people in the future. And so I came into my current position knowing that that the work that my clinic does, we would definitely share the same values. I was pretty open about how I felt about paid family leave and other benefits, even during the interview process, but also about how I was willing to do what it takes to make that happen and see what I could do to contribute. Looking into increasing capacity and providing solutions. So we're a relatively small organization, a small clinic, a relatively small budget, and definitely little staff capacity to make these changes. We did provide the same benefits as FMLA, although we're actually not covered under FMLA because we have far fewer than 50 employees. We also provided extra paid time off when you come back from taking leave, because most people would use their paid time off to supplement the time. We do have a fairly generous paid time off policy, so I was able to use some of that as well. But we came into this year and had all these big plans to start making changes, and then COVID happened. We got a new CEO, which has been really great for the organization, but it takes a little while to get new leadership into the mix of everything, especially with the pandemic going on. And so not being in being in a leadership position myself, but not in a position to actually change the policies or make the final decision, I presented solutions that I thought might work for the organization, and the HR and the finance team really took it from there in terms of looking at different possibilities for the organization. But one of the big considerations is we have a lot of part-time workers as well as full-time workers, and we really wanted something that could cover everyone, and not only cover for the birth of a child or for parental leave, but for taking care of family and for injuries or other reasons you might need to be out of the office for a longer time. We also had to take into consideration, obviously, small budget and coverage being super important in a clinic, because we can't just have people out and still provide the same services to our community. So we are still in the process, and I have to admit I haven't been on the forefront of the process now, in working on a full policy and continuing to improve our policy, but we do now have a short-term disability plan in place, and other improved benefits that should help other workers in the future, and hopefully we'll continue to be able to make more changes.
Thank you for that, and it's very inspiring to hear your commitment to proactive, courageous communication and making changes wherever you go, including where you leave. So we've got about 2 minutes before I need to pass it back to Shireen for the next portion of our webinar. But what advice would you give staffers advocating for better paid leave, paid family leave policies in their workplaces, or taking on the task of reworking them themselves?
Sure. I would say bring solutions to the table as best you can. It's much easier to present a plan of some sort and give your employer, whoever's in charge of the policies, a chance to say yes or no to things, especially if you're in a place with little capacity to take the time to do the research. I did reference some other organizations that are doing advocacy, including where Vasu works, and the Paid Family Leave in the US organization. So there are some good resources out there. But one of the things is, obviously, if you are able to find a place that shares your values to begin with, that's helpful. I know that's not a possibility for everyone, but really, really pushing your employers on how important this is in terms of keeping your employees, especially if you want to keep a millennial workforce. We're having kids these days. And don't be afraid to be a little bit annoying about it.
I love it. Thank you, Stephanie. It's great to hear your voice again. So I want to encourage folks, thank you for joining us. I want to encourage folks to put in any questions you have for Stephanie or for Vasu or Elizabeth or our own Elizabeth or Shireen in the Q&A, and we'll get to as many of those as we can at the end. And I'll pass it back to Shireen for next steps.
Yes, so if you liked all that you've been hearing from us, feel free to plug into our campaigns. We work on a lot of different issues related to gender, racial, reproductive equity. You can sign up for alerts at reproaction.org or follow us on social media. All our handles are at Reproaction. And so we also wanted to give folks a particular action point on this issue specifically. So we crafted up a little sample tweet that you could send out to either your member of Congress, local government, whoever you think is most poised to take on this issue where you live and how it would affect you. Because the bottom line is that everyone deserves the ability to heal after pregnancy or birth, regardless of the pregnancy outcome. Everyone deserves time to bond with a new child, regardless of how their family is grown. And so we want to know of our electeds what their plan is to expand and strengthen paid family leave.
Thank you for that, Shireen, and hope that many of you will take action online as suggested. So please do save the date for our next Act and Learn webinar. It will be Reproductive Justice and Astrology. Notice that it's rescheduled. That was originally planned for this month, but we reshuffled it over to March. So we're very excited about it. Please plan to join us on Wednesday, March 17th, and that will be taking place at 1 p.m. Eastern. You will get an invitation to that so long as you're signed up to our email list. If you're not sure if you're signed up for our email list, just go to reproaction.org and click to receive emails. So with that, I will now open it up to Q&A, and we did have some questions coming in, so I'm excited to share those. So first is a comment for Elizabeth that says, thank you for sharing with us, Elizabeth. I'm so sorry that you had this experience, and I'm so grateful for your actions to prevent similar trauma to others. And just here, and want to echo that personally and from the Reproaction team. So another question is, let's give this to Vasu. So are these laws that exist only for hourly or salaried positions? And how does this work for precarious employment?
That's a great question. So in terms of paid family and medical leave, those are, it varies based on the state, but the most recent laws that have passed have tried to take into account, I think what you're referencing is more like contingent work and gig work and independent contractor work and things like that. And if that's not, then I apologize, and I'm happy to re-answer. But so the more recent paid family and medical leave laws that have passed, their primary coverage or the bulk of their base is hourly and salaried employees, permanent employees, whether they be full-time or part-time. But they also include a provision that allows you, if you are self-employed, or the terminology varies, but independent contractor, you can opt into the program. And so if you were, for example, working for Lyft, you could opt into the program and pay the small payroll tax premium, which is like less than 1% of what you make, and then you would be eligible for the benefits. The FMLA is less great on this issue because of the requirement that you have to have worked for an employer for at least a year and at least 1,250 hours in the last year, because if you do that calculation, that basically adds up to you pretty much have to be a full-time employee. So there's definitely room for improvement on the FMLA front, but on the state paid leave front, it's actually really promising, the innovations that states are coming up with.
Thank you for that. Is there anything else any of our other panelists or speakers would like to add on that? Okay. So another question, and let's start this with Vasu again. What does it look like to overhaul existing paid family leave policies nationally? Are there efforts in the works to do this, or is a state-by-state approach what we're left with?
That is a great question as well. So there are efforts at both the state and national level. Earlier, I think Elizabeth mentioned the Family Act, which is sponsored by Senator Kirsten Gillibrand and Representative Rosa DeLauro, and that would create a national paid family and medical leave program similar to the models that the states use. So basically creating a national social insurance program that would extend these benefits to everyone. And we really think it's important that a federal law be passed and is that we don't rely just on state-by-state solutions, because this is something that people in every state experience and isn't something that should depend on where you live. And it isn't something that should depend on whether you have a good boss or not. It's just a basic necessity for everyone. That said, we also focus a lot on getting these state laws passed, because they, first of all, they provide relief in the moment to the people who live in that state, which is better than no one having it. But second of all, they add to the momentum showing the demand for these kinds of policies. They show that, look, this was really important for the people in Colorado or in New Jersey or Connecticut, that they have this leave, and we can point to these programs that have worked for years. We have evidence coming from these programs that it's not a problem for businesses, that workers are benefiting a lot, that businesses are benefiting a lot. And so it gives you both that momentum and that body of evidence to strengthen the case for the federal program. So it still is a combination approach, but ultimately I think we would really like to see a federal solution.
Thank you for that. Would our panelists other panelists like to add anything to that? Okay. Well, we are coming up on the end of our questions that we got in. So I want to especially thank our panelists who joined us today, Elizabeth, Vasu, and Stephanie. And thank you to our own Elizabeth Skoski for your presentation and sharing your story as well, and especially to Shireen, our Deputy Director, who pulled together this very impactful webinar. So thank you so much for joining us. We hope you'll join us next month for reproductive justice and astrology. Have a great rest of your day. Goodbye.
Thank you.